It's kind of substance misuse and comorbid mental health issues, because we find there's a huge percentage of people where those two sets of issues come together, which is why we've kind of been invited to talk tonight. Kind of fits quite well that I'm the last speaker actually, because I think what we're able to do now is give a real life example of all the principles that you were just talking about actually, sort of, you know, service user involvement and kind of all that kind of thing. So I'm just going to give you a very, very quick overview of what our programme's about, and I guess it's really the last slide that's the most interesting. So I'll try and get through all the earlier content quite quickly. Okay, so Breaking Free Group, we're a commercial organisation. We've got two bases, one in Birmingham, one in Manchester, so I've come from Manchester today. The organisation was set up back in 2010 by our managing director, Dr. Jonathan Ward, who's a clinical psychologist. So most of the work that we do is around kind of behavioural change and using technology to provide intervention techniques to allow people to change their behaviours. And really what we're about is opening up access to evidence-based, effective psychosocial treatments and interventions. We know that across the mental health service and also the addictions service as well, that there are huge problems with waiting lists. There are lots and lots of people that are waiting many months before they can actually get access to these really good quality evidence-based psychosocial treatments that they could really benefit from. So we think that actually providing those kinds of intervention techniques using digital technology is a great way to open up access and also help people to, you know, to get hold of some recovery from their issues much earlier on than they might do usually. So we've developed quite a sort of quite flexible digital platform. At the moment we've got a couple of main programmes which I'll just talk you through very quickly, but the platform's been set up so in the future we can use that same platform to develop other programmes to deal with all sorts of other kinds of behaviour change as well. So we've got some quite exciting things coming up over the next couple of years. Now, we've got a very strong commitment to research and evaluation, as you should imagine. Even though it is essentially a website, it is a clinical treatment programme. So from the very, very early days when the programme was very first developed, we were interested in including within it only the most powerful, highly evidenced cognitive and behavioural change techniques that the literature provides us with. And we're also now looking very closely at the effectiveness of the programme overall, but also the very complicated processes of diffusion and adoption, which I'll come to in a few minutes. This is just our show-off bit at the bottom. We've been nominated for quite a few awards and won a few as well, so it's just showing off basically. Okay, so we've got two main programmes. We've got our community treatment programme and also our criminal justice programme. So I'll just run you through very quickly the community programme first. It's essentially, I guess you could call it computerised cognitive behavioural therapy with a bit of mindfulness thrown in for good measure. I'm sure everybody's heard of mindfulness, quite a good solid evidence base. All the intervention techniques that we have within the programme have all been recognised by NICE as being effective approaches for dealing with substance misuse and mental health issues. So, you know, this evidence-based issue is really important for us. We've actually had quite a lot of success over the past few years in terms of actually being commissioned. So we're currently commissioned by the largest addictions treatment providers in the UK, organisations like CRI, Turning Point, Addiction. There are many other smaller organisations we've been commissioned by as well. So at the moment we're in around about 60 local authorities and we're also with a number of NHS trusts as well. So Trafford and Greater Manchester West, which are two very large mental health trusts in the Manchester area. So in terms of actually getting our programmes out there and commissioned, we're doing pretty well. Now, whereas most substance misuse treatment programmes target one very specific kind of substance misuse, so you'll get programmes that are for opiate addiction or difficulties with alcohol, the intervention techniques in our programme are all relatively generic, so it means that we can provide our programme for a very wide range of substance misuse difficulties. At the moment, we've got around about 39, I think, and the number keeps going up all the time in terms of the number of substances that our programme is appropriate for. So alcohol, and actually we find that the largest group of service users that use our programmes are using them for alcohol dependence. Legal highs, which I'm sure you'll all have heard of in the news recently, they're a massive problem. And also prescribed medications of abuse. This is another emerging population within the addictions treatment field. We're finding lots of people are getting into difficulties with medications that initially they may have been prescribed by their GP. So things like opiate-based painkillers, antidepressants, things like Valium, but they do find that they do become dependent on them. And obviously with people like that, they may not necessarily feel very comfortable walking through the doors of a traditional service where junkies and people that do crack perhaps, you know, would usually be. So we're tending to find that our programme is quite good at overcoming stigma and barriers to accessing treatment, because it is very confidential. You can just use it privacy in your own home if you want to. Nobody needs to know that you're using it. But we also do recommend that for people with complex issues, they access it as computer-assisted therapy with the support of a practitioner. But obviously, you know, again, preaching to the converted, we all know that these new technologies, if they do fly and they do work, they can really open up access to evidence-based treatment, reduce waiting times and all that kind of stuff. So that's all the great things these digital approaches provide. Now, I'm not going to dwell on this slide. This is just to give you an overview of all the very specific intervention techniques. I mean, this is a really very comprehensive treatment programme. If anybody wants these slides and wants to see that later on, do let me know. But it's just to give you an idea of the sheer sort of level of the content of the programme. Now, in addition to working in the community, we also work in prisons as well. So I think towards the beginning of last year, we were approached by the National Offender Management Service and Public Health England, and they asked us if we could produce a criminal justice specific version of the programme. This is all part of something called Gateways, which has been an initiative throughout the North West, which is all essentially intended to help reduce reoffending rates. And we know one of the big things that causes reoffending when prisoners are released is using substances. So with the support of the Ministry of Justice, we developed our criminal justice specific programme. We changed a lot of the content to make it appropriate for prison settings. I've just spent the past few months in prisons, interviewing prisoners against service user involvement, and we're just about to have that work published. We've recently had it accepted for publication. What we're finding, especially with this particular population, is that our programme is really for the first time allowing genuine continuity of care. One of the real problems with substance misuse treatment in prisons is that prisoners perhaps access great support whilst they're there, and then for lots of prisoners, either they're shifted to a different prison, because prisoners do get moved around a lot, or they obviously get released back to the community at some point, and that support that they were previously managing to get hold of isn't there anymore. So when our prison population access the programme in prison, they can then just continue to use the programme regardless of the prison that they're moved to or whether they've gone back out to the community. So it's going to be really interesting over the next few months to see the outcomes data from that. Now, we've been talking about apps. Obviously you can't not have an app when you're dealing with sort of digital health. We've recently developed our relapse prevention app. Now this is just a very small subset, the big list I showed you of all the intervention techniques. This is just a much smaller subset of those techniques. And what we recommend people do is that they do their deeper level treatment on the full online programme, and then they really just have this to augment that online programme. I mean, you can just use the app if you want, but this is really for in the moment sort of danger situations when you might be tempted to use drugs or alcohol. So one of the key features is GPS tracking. So the user can, using Google Maps, they can pin their danger areas, maybe their local pub or the road where their dealer lives. And when they're coming within, I think it's about 15 metres or something of that area, their phone will ping in their pocket and it will give them a coping strategy that they will have pre-selected when they pinned that location. So that's quite clever. That's only recently come out. So again, it's going to be great to see the outcomes from that. And that's the techniques within the app. So I guess these are the bit sort of slightly more interesting bits for you. Now, obviously, as head of research, I do all the research along with our research associate Steph, and we've conducted a huge amount of, I can't even remember how many studies we've done over the past couple of years, but we've been doing a combination of kind of your sort of standard quantitative outcome studies looking at clinical outcomes, but also lots of qualitative research as well. And this has been around not only clinical effectiveness of the programmes, but also those tricky processes of adoption and diffusion and normalisation as well, because what we want to all achieve at some point is for all these new technologies to just become a part of normal everyday practice that everybody uses. But actually getting to that point is quite difficult, and that's been one of our biggest challenges. So the research that we've done around that has been incredibly useful. But in terms of the research that we've completed, we've had everything that we've completed accepted for publication. We've had a number of publications already, a number of papers that are in press at the moment, in both UK and US peer-reviewed addictions journals. But we are starting to see from the data that we collect that there are significant reductions in substance dependence and substance use, that's alcohol and drugs. improve mental health outcomes. So as part of the assessment that we have in our programme, we have the patient health questionnaire and the general anxiety disorder scale and quality of life scale, the WHO one. And we seem to find incredibly significant improvements on those assessments when we look at the data, so that's fantastic. And also increased resilience and self-efficacy, because obviously one of the things that really help people to not relapse are being resilient and having self-efficacy to maintain their recovery. But one of the other interesting things that we're finding is that because the populations we work with tend to be very socially marginalised, as you can imagine, many of them, before they get to use our programme, have never even sat in front of a computer before. They don't really have any digital skills whatsoever. And as we all know, digital skills are becoming increasingly important as we're moving into this kind of very, very digital society that we now live in. So we're actually starting to see that the programme can really help to include people digitally that maybe previously weren't digitally included, and we've had a bit of work published around that as well. So that's kind of like a nice kind of side outcome. But some of the most robust data that we actually have to support the effectiveness of the programme is really coming from our partner organisations. So we are working with our partner organisations who collect an enormous amount of data on their service users to look at the impact that breaking free online is having. And from just a bit of analysis that we've done recently with one of our partner organisations, and we'll be publishing this quite soon, we've found that when people use our programme on top of accessing treatment as usual, they're 50% more likely to exit service successfully. So in other words, they don't just disappear. This is a huge problem in substance misuse. People will come through for treatment, but then you just never see them again. So you have absolutely no idea how they're doing. So by using Breaking Free, 50% more people actually are fully discharged and finish their treatment. And they're also 60% less likely to re-present, because there's a big problem with relapse, with addiction. Most people have to go through around about 7 cycles of attempts at recovery before they can achieve maintained recovery. So by using our programme, people are 60% more likely to have that maintained recovery. Now, obviously, like with any digital health approach, it is quite tricky getting people to actually use the damn thing, and this is something that we've been, look at the moment, we're actually starting to have it cracked. It's really bizarre. And I think for most of us, we'd really like it if there was just this one little thing, like a panacea, just some little trick we could all use to just get people using these things. And actually what we found the hard way is that there is no one answer. You just really have to go in all guns blazing and just do everything you can to support the people that are going to be using your programmes. So this is just a very brief list of some of the things that we've learned over the past couple of years. So just talking about service user and stakeholder involvement. From day one, we involved all stakeholders in the development of the programme. They're constantly being involved in the development of the future iterations of it as well. So that's all stakeholders, right from commissioners and managers, practitioners, service users, and this is why I've been in prisons for the past few months speaking to prisoners. That feedback is absolutely essential, because unless you know you have a programme that people feel they can actually use and is going to be a benefit to them, people will not use it. And the only way you can figure that out is by speaking to people. Also, because this is a treatment programme, it has to have a very clinically robust evidence base. So we're constantly conducting research, looking at the clinical effectiveness, so that's really key as well. And also that's a great way of getting people to buy in. They can see that it's clinically effective, it's based on the very best evidence, so they know that it's something that they perhaps should probably be using. Research and evaluation goes without saying, and that's what pays my wages and keeps a roof over my head, thank God. But also one of the things that we've been doing is working with external agencies to accredit our programmes as well, just to give it that bit of external validity. So one example of this is at the moment we're going through a process whereby the Ministry of Justice are accrediting us as a recognised programme that they're given a stamp of approval for. And we've also been accredited by the Oxford, Cambridge and Royal Society of Arts examination body. So anybody that uses our programme and completes it comes out with a qualification in life and living skills, which is quite a big deal for our service users because many of them have never completed their education before. Again, diffusion and normalisation, absolutely key. You can't really understand how these programmes work until you...
It's great. Yeah. I love it. I'll apply this one.
So yeah, there you go. You can't really understand how these programmes are working without ensuring that you're understanding the diffusion and adoption process. That's a key part of the research that we're doing. And what we're really having to do is evolve the sector. The substance misuse sector previously hasn't used technology that much. I mean, it took people years to get used to online case management systems. So we're having to support every stakeholder and really help them to shape and evolve the sector so that these kind of digital approaches to substance misuse recovery can be better accommodated and used. And I mean, this is something that I can't really comment on because I'm a researcher, although our commercial director Clive is here today. So we've demonstrated over the past couple of years that you can create a commercially sustainable model, although it hasn't been easy, it's been bloody hard, and there are no shortcuts, it's just been exhausting, but it's possible. So I think that's everything from me. Thank you.